our impact is measurable. For example, we helped shape Kenya's 2015 adolescent sexual and reproductive health policy. We led the 2019 National Violence Against Children survey that guided strategies to prevent violence against children in Kenya. Our research has informed the development of a Kenya national scale-up strategy to address reproductive coercion and intimate partner violence, and improved access to contraception and reproductive health-related counseling services across the country.
I think one of the most important things for women and girls is equal agency. And at least for me, a key pathway to this is education. And one key challenge is gender-based violence, which can stand in the way of girls safely accessing schools. Some solutions being explored are creating safe spaces for women to regularly meet and collecting real-time data using technology, which allows women to report violence against women in real time. And these have been really promising.
From 2017 and 2021, we tested the impact of comprehensive sexuality education taught in government schools when linked to sexual reproductive health services and observed adolescent pregnancy trends. In the intervention arm of this study, we noted up to a 50% reduction in adolescent pregnancy, thereby guaranteeing girls continued education.
Another intervention, which I thought was also innovative and in a way groundbreaking, was one that we implemented among factory workers in Alexandria. Those garment factory workers did not have services, did not have reproductive health and family planning services before we joined, before we implemented the program. So our program included raising their awareness about family planning and reproductive health and making services available through the mobile clinics that are operated by the Ministry of Health and Population. The reports that we got from the women that this was, again, a very instrumental and key intervention for them because it saved them time to go and seek services outside the factory. And it made services available for them. Those women used family planning in order to avoid unintended pregnancies, which eventually will translate into gains for both the women and the factory owners and managers.